Hi, my name is Kristen Weber, and I'm hoping to take the next 10 minutes to bring attention and awareness to a huge social issue that really warrants change and action. The current issue is that individual states and insurance companies have the power to deny coverage in part or in full for individuals seeking eating disorder treatment. I propose a push for action against individual states and insurance companies in the denial of eating disorder treatment. So just who and how many people are affected? In the United States, 20 million women and 10 million men suffer from a clinically significant eating disorder at some time in their life. When I speak about eating disorders, I'm including anorexia, bulimia, binge eating disorder, or an eating disorder not otherwise specified. There can be a wide range of health consequences of eating disorders. Typically, the longer an individual suffers from an eating disorder, the more severe and progressive the consequences will be. Some health consequences of eating disorders are abnormally low heart rate and low blood pressure, heart failure, muscle loss, dehydration, kidney failure, electrolyte imbalances, pancreatitis, tooth decay, hair loss, gastric rupture, and even death. One specific eating disorder, anorexia nervosa, actually has the highest mortality rate out of any mental illness. The good news is that there are effective eating disorder treatment and that treatment does exist. Fortunately, it is often lengthy and expensive. Integral parts of treatment can include cognitive behavioral therapy, oversight by physicians, dietitians, and nutritionists, psychiatry, medication management, inpatient stays, and residential treatment. To give you an idea of how expensive residential eating disorder treatment costs, one single day in residential eating disorder treatment is in the range of $1,000. Currently, each state is allowed to create their own definitional criteria for treatment of eating disorders. As a result, some parts of the United States are able to refuse coverage for eating disorders. Insurance companies use several tactics to avoid or minimize the cost of eating disorder coverage. These restrictions can include lower caps on mental health care than physical care, limits on number of covered therapy sessions, limits on days of residential or inpatient treatment, and lower lifetime and annual maximums. Many health insurance plans provide inadequate coverage for eating disorders, and some categorically exclude eating disorders from coverage altogether. The Department of Health and Human Services allow each state to choose a benchmark plan from a list of several existing options in that state, some of which severely limited or even exclude eating disorder coverage. So what steps have already been taken? In 1996, the Mental Health Parity Law was passed. This helped expand mental health coverage by equating aggregate lifetime limits and annual limits for mental health benefits with aggregate lifetime limits and annual limits for medical and surgical benefits. Unfortunately, the law did not require that plans include mental health coverage. Its mandates only applied to plans that elected to cover mental health. The Mental Health Parity Law was updated in 2008 when Congress passed the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act. This act applies to substance abuse disorders and requires that large group health plans and Medicaid managed care plans provide coverage for mental or substance abuse disorders on par with the coverage offered for physical ailments. Almost every state has passed some version of a mental health parity law. Unfortunately, state parity legislation often suffers from the same shortcomings as the federal legislation, including only applying to large group plans and cover only a certain list of mental illnesses. Currently, fewer than half the states have parity laws that actually require some degree of coverage for the treatment of eating disorders. There also is the FREED Act, which stands for Federal Response to Eliminate Eating Disorders Act. This has been drafted by advocates, and the Act is a comprehensive bill addressing research, treatment, education, and prevention of eating disorders that would require eating disorder coverage. Unfortunately, it still remains unclear when and if ever Congress might pass the Freed Act. Another big change was the Affordable Care Act of 2010. This had a lot of promise and made advocates of eating disorders very hopeful that change was coming soon. The Affordable Care Act includes a list of 10 essential health benefits, otherwise known as EHB, that establish a minimum floor of services that all health plans will be required to cover. One of the 10 essential health benefits is the category is mental health and substance use disorders. But this does not specify and define the category to include a list of what mental illnesses are included in this category. It's very broad. So instead, the Health and Human Services gave each state the authority to define exactly what items and services would be included in the essential health benefits package. My proposed solution is that to create a federal benchmark plan for mental illness. This would mean that the Secretary of the Health and Human Services can authorize the power of the Health and Human Services Department to define the essential health benefit mental illness category. The first step in defining this category would be to include all DSM-recognized eating disorders as falling into this category. Then, by taking guidance from the American Psychological Association's practice guideline, Health and Human Service Department can then define the parameters for what constitutes eating disorder treatment. By the Department of Health and Human Services providing this definition of specifically what mental illnesses are included in the essential health benefit mental illness category as part of the ACA, that individual states and insurance companies wouldn't have the power to then say that eating disorders are not included in it, because it would be specifically laid out that they are included in this essential health benefit, and the insurance companies would be obligated then to cover such treatment. So what steps can we take to pass this proposal? I suggest that advocates, individuals suffering from eating disorders, friends, family members of individuals who are suffering from eating disorders, professionals in the eating disorder mental health field, and educational departments write letters of support addressed to the Secretary of the Health and Human Services Department, encouraging her to define the mental illness essential health benefit category as part of the affordable health care. The Secretary of the Human and Health Services is Sylvia Matthews Burwell, and she is at the U.S. Department of Health and Human Services, 200 Independence Ave, Washington, D.C. By really starting to lobby and bring awareness and put pressure on the Secretary of the Health and Human Services to really use her power and to act, this will help spread the awareness and get the issue out there that there are millions of Americans who are suffering and are literally dying trying to get treatment coverage to fight their eating disorders. Eating disorders thrive and really progress and encourage secrecy and loneliness and shame. And when individuals are actually ready to step forward and admit that they need help and that they want treatment, they shouldn't have to face extra barriers to get the treatment that they really deserve and have a right to by the insurance companies saying, no, we won't cover it. So, as said before, each individual deserves the right to get healthy. So I really urge you to get on board and start writing letters to support that that the Secretary of the Health and Human Services does the federal benchmark and puts a definition to the mental health category as part of the Affordable Health Care Act. Thank you.